How are you doing today?
Hi, Janelle. I'm doing well. Good to see you.
The Hazelden Betty Ford Foundation has been providing healing and hope to individuals, families, and communities affected by alcohol and other drugs for more than 70 years. And while we're in 7 states and we have 17 facilities across the country, there's still a lot of people who cannot come to us to receive the life-saving care that they need. And so virtual care is really our way to reach those people.
So virtual services provides opportunity for our patients to be able to connect online with a licensed clinician that will be providing evidence-based treatment that is individualized to meet the patient's needs.
When we launched this venture in 2019 and piloted virtual intensive outpatient, there was a number of concerns and questions that came up, and one was how difficult was the technology, and we saw it actually turned out to be very simple, and even for people who weren't tech savvy, they were able to access the tools in the system. From a privacy perspective, all of our virtual services are meeting the privacy regulations from a state and federal perspective, and they're HIPAA and 42 CFR telemedicine compliant.
We actually go above and beyond what the U.S. government requires. So you can be confident that we will be providing a secure setting, both in an audio and in visual format.
We had some questions and concerns about the level of engagement. We saw that was actually better because people could access these services no matter where they were. And there were some concerns and questions about the kind of rapport and therapeutic alliance with the other patients and with their provider. And we really saw that with the regular face-to-face meetings, that they were able to build great relationships.
Okay, welcome to our Wednesday night virtual intensive outpatient group.
As a patient, you will go through our patient access team, which will sit and talk with you to see if you are appropriate for virtual services or our virtual intensive outpatient program. But anyone with a cell phone or a tablet or a computer can easily access virtual services. As a patient, you will receive an email invite. And once you access that email invite, you will create a login, which will include your date of birth and then a password. Once you've done that, you will be able to hit go and be able to access our virtual services. It's just that easy. Your clinician will schedule all of your appointments, and you will receive reminders both 24 hours prior and 30 minutes before your group or individual sessions. You would just access through your dashboard and click on that appointment, and you'd be immediately connected to either your group or individual session.
Hi, Danielle.
What we know from the research is that the longer that a patient is engaged in services, the better the outcome. And so what we want to do, whether someone's been in a residential or an inpatient setting and then came to an intensive outpatient level of care, or they started with intensive outpatient, we want to extend that length of engagement to get that better positive outcomes in the end. And with a lot of people, whether they live in a rural community or have other reasons why they can't come to that intensive outpatient in person, virtual allows them to continue to have that longer engagement with us in our services and trying to achieve those better outcomes in the long term. And we've gotten really positive feedback from all the patients that went through the pilot and the virtual intensive outpatient program. They've been really building great relationships with their providers and happy with the services and the outcomes that they received.
Thanks, everybody. I had a good group.
RecoveryGo Virtual Services is an amazing opportunity for our patients to continue to receive an in-person experience, but through the convenience of an online platform.